All right, good morning, everybody. How are you? Good. What a great crowd. Woo! Okay, so I got a timer. I'm going to keep us on track. I got 15 minutes to talk about a lot of things. And to just kind of contextualize what I'm going to do in the next 15 minutes, I really want to just give a brief overview of what's happened to us over the last 5 years as a community. And it's my job to really take the great acknowledgement and the great work that happened in the first part of the morning around our child welfare outcomes and tie it to the greater overall community-based safety network that we've been doing, and to really show those connections and really, most importantly, launch us into the richest part of the day, which is for us to hear from you about what's working, what needs to happen next, what are the barriers and challenges that you face in your work in accomplishing this great community-based collaborative effort that we have underway to really better serve the kids and families and individuals that live in our community. So that's really what I'm here to do in the next 15 minutes. I just want to give, all the great accolades that we just received as a community for our incredible outcomes that we've achieved in child welfare and in other systems have occurred during the most difficult period of probably anyone's careers that's in this room. We experienced the worst economic recession since the Great Depression. And as a result, this is hard to understand, but basically loss of money, funding going down. And on the right-hand side, you'll see just the incredible increase in service need that's occurred in Boulder County. So I remember when I started as the department head, we had a little under 16,000 people on the Medicaid system accessing health insurance, and a little under 9,000 people accessing the food assistance program. And everyone told me how high those caseloads were, that we'd never really experienced anything like this. And now you look today at where we are. We're at about 45,500 individuals accessing the Medicaid program in Boulder County, another 11,000 that are accessing the exchange, a little more than 10,000, and almost 20,000 individuals on the food assistance program. And at the same time, Boulder County's experienced the two most significant disasters in Colorado history. The largest fire at the time, 4 Mile Fire in 2010, and then a much more significant and devastating, the floods of 2013. So this great community-based work, which you can feel palatably in the room here, has occurred in a very disruptive economic and environmental cycle that really we should all be incredibly proud of what we've done in this window. And the next slide will just show you why we want you to help us with this conversation. So this slide shows you just the sheer magnitude of the touches. This is within our department, the number of individuals and households that we are touching every day during the course of the last 12 months. So this is our data through the end of August, and why it's so important for us to think in a much more comprehensive fashion, where we're integrating services, where we're thinking across systems, where we're trying to figure out the prevention edges where we can better serve our populations. Because as Dr. Sanders mentioned, the best child welfare case is the one that we never see. And we know that only occurs in healthy communities. And healthy communities are only possible when they're built on integrated prevention systems. And integrated prevention systems don't just occur by accident. They don't occur because we want them to or because we talk to one another. They occur because we do very tangible steps to make them happen. So as you can see, there's tens of thousands of people coming to us on a daily basis. And this doesn't include all the other individuals that are coming to your systems that either are overlapping with us or are close to coming to us. And so how we work together in that context is critical. So one of the guiding principles of our work that has driven not only better child welfare practice, but better community collaborations is really built on this concept of the social determinants of health. And we work really closely with our partners in the health system, the hospitals, the clinics, the public health system, to really make this tangible with our mental health partners as well. And the basic premise of this is that healthy, thriving communities only occur when social determinants of health are addressed. And this is borne out by research across the globe. And not surprisingly, you spend more money on health care costs and get worse outcomes when there are not adequate investments in social well-being. So the places that spend the most on health care and have the least healthy populations with some of the worst outcomes are the ones that tend to be under-resourced and under-integrated into the social determinants of health pillars of family stability. And so you'll see this as we move into the focus groups. And this is why we've asked you to come talk with us. So the outcomes that we see in child welfare are, again, really connected to our efforts to integrate and stabilize families and individuals across these main domains of well-being: housing stability, employment and income stability, access to adequate food and nutrition, health and well-being, safety, and education. The other piece of work that our department's been involved in with our partners across the state and around the country has been really trying to look at what we call the generative model. It's come out of a lot of work that we've done at Harvard together and with our peers around the state and the country. And the basic premise of the generative model is that most of our systems historically are built inside of this box, a regulative business model box. And a regulative business model is really built on a compliance-driven oriented service system. So we each receive money to do certain things, and we check certain boxes to show that we've complied with the money. And we think that we've then achieved something by doing that compliance-oriented function. And it's not to dismiss the nature of regulation or the purpose of regulation, but it's really to acknowledge that there's only so much that can be done inside of a regulatory window itself. And that if we want to achieve better outcomes as a community, we have to move up this value curve, this community value curve. And the stages of our work, which you can kind of hear about as we talk about a lot of the initiatives that are underway throughout our county, they're very easy to see what they mean. So we begin sort of stretching our muscles by collaborating more. You know, we work together, we talk about working together, we think about what working together means. And as we begin to more integrate our service functions, where we actually share data and we drive our systems to greater outcomes, and we focus on targeted prevention efforts that are really designed to hit key community vulnerability points, just like Dr. Sanders mentioned, is a great example of doing that kind of work. How do you integrate your fiscal models and your data models to really comprehensively attack defined community problems in a way that is going to create greater solutions? And as you move yourself up this value curve, you're able to serve more and more people with the dollars that you have, because you're becoming more preventative. Your services are being driven by the people that you're working with. And in a lot of our ultimate destination is really to be co-creating these solutions with the families that we work with. And so all of our system redesign in HHS, and that we've been working with you guys on a daily basis, has really been hearing from our community and hearing what they want from us, which are non-institutional based solutions. The people that we serve, they want community-based solutions. They want prevention, they want easy access. They want to live in the community. They don't want to live in placement or detention or hospitals. They don't want to live and be served in systems that feel heavy on the intervention. They want more light touch. They want more self-sufficiency. They want more proactive and prevention activities. So as we've worked in this context, we've really found we've been able to serve a lot more people a lot more effectively with a lot more outcomes. And so it's in these lenses that we see our child welfare practice change. And so our child welfare practice change has been evolving just as our relationships with you are, and the way that our housing systems are evolving, the way that our child care systems are evolving. And just some of the fundamental principles that we follow in our child welfare practice are really, we strive to keep families together whenever possible. And we believe that they have the solutions for their well-being. and that if we support them in finding those solutions, we're going to achieve better outcomes for the kids and families, and that the kids are going to be most safe when we strengthen the family. And that really, as a result of that fundamental core belief, all of the concentric circles beyond the abuse and neglect system in the community need to be focused in similar manner, because it'll prevent us from using these high-cost, high-institutional interventions in our service system. And the next couple slides show what that's really looked like. So inside of our child welfare system, we've seen a more than 50% reduction in our out-of-home placement rate since we began this redesign work, while our referrals have continued to grow, and we've also reduced our open involvements, our open cases. And the next slide will show you the reduction in dependency neglect cases. So what this means is more families are being proactively served by all of us collectively in the community in a preventative manner, and less are needing to enter the court system, and less are needing to enter the placement systems. And the next slide also shows that there has been no reduction in the absence of abuse after services as a result of this effort. Because for our workforce to do this work, it means we're actually taking on more risk. When we serve kids in the community in a proactive way, in the home, with wrap services, we're actually taking more risk in that individual case. In the long-term benefit of the community, we believe we're taking less risk, but as an agency on a daily basis, we're actually taking more risk, because we're serving cases that we traditionally could have used an institutional response for in the home, in the community. And we also see this on the next slide replicated in other systems. So our work, this is the impact partnership slide, of which many of us are part of the impact partnership. We've seen really significant reductions in our placement rates and our commitment rates and our detention rates simultaneously while we've taken on this effort. And one of the ways we've done that, this is one of the major efforts we've taken on in child welfare, which is permanency efforts. So we've sort of taken on a relentless approach to any child who's in placement. We're going to find permanency for. We're going to remove them from placement. We're going to find them a forever family and a permanent solution. So each of these things happens inside of the context of a social determinants of health model and a more generative framework of work. So I just wanted to highlight one of these prevention efforts that we've been working on. This is a community-wide collaborative to really enhance housing stability. And so one of the fundamental premises behind our merger between our two agencies was the community begging us for probably 10 years that our systems were too siloed, that there was duplication of effort, that it was hard to access services, and that fundamentally human service outcomes are driven by having access to housing. So we worked with our community partners to build a more titrated access to housing supports and resources. What this means is we have really tangible ways that we can provide immediate access to housing when a crisis happens. So when we have a presenting child protection referral, or we're working with a Sister Carmen partnership or our center partnership, if there's someone whose family is going to fall into great and tremendous risk, we move housing resources immediately as we can to those families, so that we know we'll be able to prevent the institutional responses later. And on the next slide, what you'll see is this is an example of what that's meant. So the partnerships of the agencies on the right are doing all the decentralized case management as we've brought housing resources and supports to them in a proactive manner, because we know, for instance, that this is going to achieve better outcomes in child welfare. But it doesn't just achieve better outcomes in child welfare, it achieves better outcomes in the educational systems as well. So this has helped about almost 2,000 households at this point since 2008. The other thing that we've learned a lot over the last 5 years has been comprehensively integrating our community partnerships and focusing together in a collective way. Oh, I'm running out of time. Focusing in a collective way on the pillars of family stability moves to better self-sufficiency outcomes. So we see that in the data, and this is from the data of 3,000 individuals that have been helped by this partnership that I showed on the last slide. So tremendous progress by working together. We've also seen amazing educational outcomes. This is an example of how we've used our tenant-based rental assistance. It's a rental assistance program for homeless children in the school districts. And it's only been in existence for 2 years, and I won't read all of these, but these are tremendous outcomes to see from an educational perspective by tying case management and prevention services to housing stability. Okay, so what we kind of see moving ahead, and what we're hoping for the focus groups today is for you to really talk with us about these pillars of family stability and our work to move into a social determinants of health model collectively. How do we actually go further together into this prevention model? What are the kind of strategies that we need? How do we identify better work together? And our agency really sees, and we've heard already in the conversations we've had from folks in multiple settings over the last few months, people are looking and they're hungry for in our community, the service providers, a more constant feedback loop of information and learning. And we're trying to work on that. So we're evolving as a system really quickly. People are hoping that as we shift our work, we're changing it. We're sharing that information. We're receiving information to make the appropriate changes. So this today is part of that. We've also heard a continuous learning environment is really what our safety net community's been asking for. We've also heard a powerful trend that we need common community indicators across multiple systems to work on together and set forth our course of work, and that we need to integrate some of these community strategic plans that we have. So while you're at the focus groups, which is we're going to launch right into, the next slide talks about the sheets before you. So there are in the middle of your table a cheat sheet that you can write down your thoughts, and you have a facilitator and a note taker at your tables that will guide you through these conversations.